I am Frederick Bien. Let me introduce you to Community on Call. We are a new company that's activating healthcare-related communities. Here's what I mean by activating community. I manage an organization for families affected by mental health illnesses. And last month in Facebook, our messages were seen by 20 million people. We have activated this community by identifying members who can speak with commitment and experience to other members to provide mentoring and peer support. Why peer support? Let me show you through an example the impact of peer support. Oh, sorry. We need some, there we go. There's a community in South Africa called Mothers to Mothers that has virtually eliminated the risk of transmission of HIV from mothers to babies by enabling mothers with HIV to speak with pregnant mothers and thereby communicating in practical, simple ways the care that is required. Peer support is extremely powerful. The government and private businesses could not do this as fast as Mothers to Mothers was able to do it. There are many organizations that could use peer support. Cancer, especially breast cancers, have done it for many years successfully. Chronic illnesses are starting to do it more and more. Substance abuse, stopping people from drinking, smoking. And I don't know if you realize, but we are in the worst epidemic of drug abuse in the US. In fact, I don't know if you saw 2 weeks ago, President Obama was in town to talk about it, and he committed $1 billion to help solve the problem. Behavioral health is also full of opportunities for peer mentoring. And I apologize if I'm going to make some people uncomfortable a little bit here, but it helps sometimes to move. But if you think about the worry of parents for online video gaming, online porn that afflict many men, domestic violence or binge eating that tends to affect more women. So I hope I got your attention and I got your interest because you probably know somebody around you who is affected by these issues. There's money being thrown at these problems, and naturally, psychologists have looked at them. Some of the best psychologists, like Bill Miller or Phil Zimbardo, wrote a whole book about it recently. Their recommendations are simple because the problem at the core is about being left alone, being isolated. So here's their recommendation. To reduce the problem, get a mentor, be a mentor. So organizations need to deploy mentor systems. And now through social media and technology, it's possible to do it everywhere. To do it in the street, in your office, in your bedroom, even in the bathroom. So it creates opportunities. And how can you be alone, by the way, in a big city? But if nobody texts you or calls you, you're virtually alone. Community on Call builds bridges between friends and families and therapists and doctors on the other side. Therefore, our logo is a bridge. So communities need to deploy faster and efficient peer support systems by recruiting and training mentors, by matching mentors with mentees, by facilitating the conversation, potentially using natural language processing, and also creating a dashboard so community managers can see the progress and the activities in the peer support. You know, one community I mentioned earlier, we've implemented such a solution. And we created a pilot test with real people, real mentors. And it's going super well. Feedback is extremely positive. We've leveraged existing technologies and unified them into one unique solution that is working. As I mentioned, mentors and mentees have become raving fans, and we plan to expand the pilot test because initially we limited it to a restricted group of people. So solving peer support in digital media is a big opportunity. It's a big problem. There are 369,000 organizations in the US that are not-for-profit, many of which have communities. They spend $5.4 billion per year in IT services, and their budgets are growing. Community on Call will offer a robust solution for digital peer support. And why can our team do it? We have a group of people with backgrounds in media technology, in management of technology, in marketing, in finance, and of course in mentoring. And my background itself is to have built 2 internet companies in California, 1 social media company here in Atlanta. All 3 grew for years and they were sold at a profit. And I was also Senior Vice President of Media Technology for Turner Broadcasting. So in summary, we are experts in deploying and activating healthcare communities with peer support. And peer support is most efficient when you can make it widely available, safe, and scalable.